Hello and good morning. My name is Nur Ain Miti Hamka and my metric number is 180308. Last week we have been given this assignment of this case study about what happened if the cattle eat fertilizer urea more than 500 grams. Based on our discussion, we have found that at the end the cattle will die. But first thing, I'm going to explain to you about the cattle and the urea. Cattle, digestive system of a cattle mainly consists of 4 stomach, which is omasum, abomasum, which is the true stomach, rumen and reticulum. Okay, about the urea. Urea is a simple compound that consists of 46.7% nitrogen. But why the farmers use urea in their to feed to the animal? Because it is very cheap and improving the intake of poor quality feed. It is also very cheap compared to other protein, but actually it's not that good for the cattle. And urea can be very toxic to ruminants if consumed too quickly. Okay, based on our discussion, we have found that rumen microbes, the stomach of the cattle, rumen microbes convert urea to microbial protein and ammonia. The microbial protein will flow past the rumen for digestion and absorption, mainly in the small intestine. The ammonia is absorbed in the rumen, reticulum and omasum. It is carried in the portal vein to the liver, where it is detoxified to urea, amino acid, and many more. Some ammonia escape from the liver into the general circulation. But in oral urea poisoning, is basically poisoning due to excessive ammonia production in the rumen. When ammonia levels in rumen fluid exceeds 500 to 800 mg per liter, ammonia levels increase in the peripheral blood. Thus, after ingestion of urea and rapidly, when ammonia levels exceed 6 mg per liter in peripheral blood, signs of poisoning may occur in the cattle. After that, when it's been poisoned, at the end, death will occur. That's only for our discussion. So yeah, thank you.
Good morning. My name is Yim Yan Ne, matrix number 180304. Alright, for my video today, I'm going to discuss about treatment for urea poisoning. The background for this is that last week we had a discussion with our group about what would happen if a cattle ingested 500 grams of urea. So the conclusion of our discussion is that the cattle will die from urea poisoning. Sorry. Okay, so for my part, I'm going to talk about the treatment for urea poisoning before the cattle dies. So first, we need to check that the cattle is appropriate for treatment. That is, first it should not be violent, it should not be moribund or recumbent. And we also need to check its ruminal reticular fluid before any treatment is imposed. Okay, first of all, one of the treatments is to infuse 5% of acetic acid, which is vinegar, and also ice cold water, about 0 to 4 degrees Celsius. Okay, the acetic acid, the vinegar, is actually to lower the ruminant's pH, the stomach rumen, the pH level to lower, because the urea poisoning will cause the rumen to have an alkaline medium. Okay, so it also prevents further absorption of ammonium by converting uncharged ammonium to charged ammonium ions. The cold water lowers the rumen's temperature and dilutes the reacting medium. It also slows down the urease activity. Urease is actually the enzyme to convert the urea to ammonia by the microbial organisms in the rumen. Alright. Okay, besides that, I'm also going to talk about the prevention and control to prevent urea poisoning from actually happening. So it all goes down to how much urea to give the cattle as non-protein nitrogen. Okay, so the urea fat should not be exceeding 2 to 3% of the concentrate of green portion of the ruminant diet, or less than or equal to 1% of the entire diet. And also, the ruminant should be adapted slowly to the urea diet. Thank you.
Good morning. My name is Tan Zermin, metric number 180353. Today I'm going to talk about what will happen if a cattle ate 500 gram of fertilizer grade urea. The most common NPN source used in ruminant feeding is urea. However, excessive addition of urea or failure to convert to ammonia and or simply NH3 in treated feed can lead to urea poisoning in cattle. Poisoning by ingestion of excess urea or other sources of non-protein nitrogen is usually acute, rapidly progressive or highly fatal. In cattle, there are rumen microbes. The function of rumen microbes is to convert urea to microbial protein and NH3. The microbial protein flows past the rumen for digestion and absorption in the small intestine, while NH3 is absorbed in the rumen, reticulum and omasum. It is carried in the portal vein to the liver, where it's detoxified to urea, amino acid, and etc. Some of the NH3 escape from the liver into the general circulation. Okay, so oral urea poisoning is basically poisoning due to excessive NH3 production in the rumen. Normal levels of NH3 are 60 to 680 mg per liter in rumen fluid and 0.8 to 2.5 mg per liter in the blood. When NH3 levels in the rumen fluid exceeds 500 to 800 mg per liter, NH3 levels increase in the peripheral blood. Thus, after ingestion of urea, levels of NH3 in rumen fluid and NH3 in urea in blood pressure is increased. When NH3 levels exceed 6 mg per liter in peripheral blood, signs of poisoning may occur in cattle. Okay. So the main signs of urea poisoning are due to the alkaline corrosive effects of the high NH3 levels in the digestive tract and other tissues and the neurotoxic effect on the brain. Signs of poisoning arise within 10 to 30 minutes of ingestion of toxic doses. There are three main types of poisoning: acute poisoning, which is severe, subacute, moderate, and chronic, which is mild. Acute severe signs include salivation, severe abdominal colic, bloat, forced rapid breathing, muscle tremor, incoordination, bellowing, convulsions, violent struggling, weakness, recumbency, coma, and death within 4 hours of ingestion. Subacute or moderate signs include abdominal colic and milder nervous and circulatory signs. Chronic signs include poor appetite, listlessness, and lethargy.
Hi, my name is Amira binti Muhammad Halimi. My metric number is 180297. Okay, the scenario description. The most common NPN source used in ruminant feeding is urea. However, excessive addition of urea or failure to convert ammonia in treated feed can lead to poisoning in cattle. The poisoning by ingestion of excess urea or other source of non-protein nitrogen (NPN) highly fatal. In cattle, there are rumen microbes. The function of rumen microbes is to convert urea to microbial protein and ammonia. The microbial protein flow past the rumen for digestion and absorbed in small intestine, while ammonia is absorbed in rumen, reticulum, and ovasum. And omasum. It's carried in the portal vein to the liver, where it's detoxified through urea amino acid. Some of ammonia escape from the liver to the blood by circulation. Poisoning is basically due to excessive ammonia production in rumen. When the ammonia level increase in blood, signs of poisoning may occur in cattle. The main signs of urea poisoning are due to effects of high ammonia in digestive tract and other tissue. Signs of poisoning arise within 10 to 30 minutes. There are 3 types of poisoning. One, acute, then subacute, and then lastly chronic. Acute signs include salivation, forced rapid breathing, incoordination, weakness, coma, and death with 4 hours. Subacute signs include abdominal colic and circulatory signs. And the last 3 signs is chronic signs include poor appetite and lethargy. That's all. Thank you.
Hello, my name is Michael, matrix number 176349. So today we have a case study that has to do with excessive urea being intaked by a ruminant. Now, first thing I want to explain is about ruminants. Ruminants, in this case we're talking about cows. So cows, one thing special about cows is they have one stomach but 4 chambers. These 4 chambers are divided into the rumen, reticulum, omasum and abomasum. Now, urea plays the most role in the rumen and reticulum itself. Urea is actually a supplement that you give to a cow that replaces protein. It's a cheaper form and it can be effective. However, urea is not as palatable as compared to other pastures. So, first thing I want to tell you about excessive urea intake is the symptoms that you will go through. Okay, so urea, when a cow or cattle has excessive urea inside of its body, it will exhibit signs of bloat, excessive salivation, forced rapid breathing, muscle tremor, convulsion, weakness, and in severe cases it will cause tetany that will lead to death. So urea actually is a good thing. Urea, when it enters the rumen, it will be converted to ammonia and also microbial protein. So this protein is the one that I said earlier on that will go into the, if I'm not mistaken, is the abomasum, and it will be directly absorbed by the cattle, which will become the protein for the cattle. The problem when there is excessive urea is that when the conversion occurs from urea to ammonia, there will be excessive ammonia inside of the cattle. So when there's excessive ammonia inside the cattle, the hepatocytes will not be able to detoxify this excessive urea, and this will increase its amount inside the blood, the cerebrospinal fluid and other tissues. So when there's excessive ammonia inside of these animals, this inhibits the Krebs cycle in the liver itself, which will end up leading to lower energy production, and thus anaerobic glycosis will occur. So when there's not enough energy, then the cow will not be able to perform its daily functions. It won't be able to move properly. It will start having muscle weakness, and when it doesn't have enough energy, most metabolic activities will be stopped. So it leads to death. So that's all I explain about excessive urea intake in cattle. Thank you.
Assalamualaikum warahmatullahi wabarakatuh and very good morning. My name is Siti Fatimah Zahra binti Abdul Rahim. My metric number is 180306. Okay, today I'm going to talk about what happens if a cattle eat more than 500 grams of urea fertilizer. Okay, after going through a lot of research and discussion, we can conclude that the cattle will die because of urea poisoning. Okay, here my part is I'm going to talk about what is the main sign or symptom happen before the cattle die. Okay, the main sign of urea poisoning are due to the alkaline corrosive effect of the high ammonia levels in the digestive tract and other tissues of the cattle itself. Okay, there are three main types of sign. First is acute or severe, second is subacute or moderate, and last one is the chronic or the mild. Okay, acute or severe shows the sign of excessive salivation, severe abdominal colic, bloat, rapid breathing, muscle tremors, incoordination, coma, or death within the 4 hours after injection. Okay, for the second type is subacute or moderate. Subacute can happen if there is not so much urea poisoning in the stomach or rumen. Okay, the example of the sign or symptom occurs is that the abdominal colic and milder nervous or even the circulatory signs. Okay, the last sign is what we call chronic or the mild one. Okay, chronic or mild types of symptom for the cattle is a pure appetite, listlessness and lethargy, or even the tenacity that can cause the death of the animal itself. Okay, there are few treatment that can be done so that the cattle will not going to die or lot of pain can occur. So some the basic things that we have to call the veterinary medicine doctors. They need to do some checkup and to make sure that it is really urea poisoning. Okay, the vinegar is a helpful emergency treatment for urea poisoning if the animal is treated before tenacity develops. Okay, besides that, they can also bring the cattle to the nearest veterinary hospital so that the further study and further discussion, further treatment for the cattle can be done. Okay. Before that, the primary mechanism of ammonia poisoning is by inhibiting the Krebs cycle, which will lower the energy production, leading to anaerobic glycosis and systemic metabolic acidosis. This is why the animal cannot done their daily life or daily routine as a normal cattle and need to stay in pain for a lot of time. Okay, that's all from me. Thank you. 1 minute.